Hi, I'm Dr. Keshav Malhotra. I'm the director of Meta and also the lab director of Rainbow IVF. A very important question that most of you ask me is how to choose the right consumable. Now, whenever I'm trying to choose a consumable, there are a few important tests that I look after. Now, especially for my semen containers. Now, this is very important. Most of these tests are actually mentioned on the back of your consumables, and these are things that you should be taking into consideration. So the first thing that I look at is MEA, which is mouse embryonic assay, and the cutoff that we generally want to use is about 80%. So what they do is that they would expose the mouse embryos, 2-cell mouse embryos, to the product that you're using and then grow them to blastocysts, and at least 80% of the exposed embryo should be growing to blastocysts is what we are trying to check. Now, other important things, especially when you are trying to choose culture dishes, is basically whether it's tested for sterility. So there's a test known as the LAL test, which basically would tell you that the amount of endotoxins present on the device should be less than the threshold. Now, some of the thresholds would mention 20 EU, some of the thresholds would mention less than 0.03 EU per ml. Now, these are things that you would want to check. Another thing that I want to check is whether it's a medical grade product or not. So that should be mentioned on the device itself, whether it's tested for IVF or not. That should also be put on the device or the consumable. And again, things that I would want to check. Now, some of these dishes will also tell me that it's tested for heat transfer. Now, like I'm checking these dishes now, it says that there's excellent heat transfer between the product. Now, this is again important because we know that we're going to put them at 37 degrees, and I want that at least the dish maintains 37 when I put it into the incubator or put it on the warm stage. So these are certain important things that you would see on all of the different consumables. Some of them would also show sterility and how they are sterilized. So whether they're sterilized using gamma irradiation, etc. This is again something that you can actually check, and it should be mentioned on the device. Whenever you're using a device or a consumable, always put the lot number of that consumable on your checklist. What this helps you in actually doing is that if patients are sharing the same lot of products, and if there is some problem which happens, if let's say your fertilization rates go down or your blastulation rates go down, you can go back and check the lot numbers which were associated with those rates and then come to a conclusion, especially when you're doing your troubleshooting exercise, on what actually is going wrong. This holds true for your consumables. It also holds true for your medias, for your freezing medias, for your freezing devices, and anything and everything that you use within the laboratory. So hope these tips were useful to you in choosing the right consumable. If you have any queries for me, do get in touch with me on my social media. I'm available on Facebook as well as on Instagram by the name of Meta Embryology. I'll be happy to answer your queries there.